Greetings, my fellow YouTube nurses. Are you ready to learn some nursing experiences? If you are to the right nursing channel. So, remember me, Nurse Mendoza? You guys remember me? Hey, my boy.
Nurse Bravo.
That's right. So, the very first thing you guys want to talk about is what happens when someone comes in with some chest pain, okay? Left radiating arm pain or right, whatever, and all of a sudden they have shortness of breath.
Nausea, vomiting. Diaphoretic.
Diaphoretic. What do you do as a nursing instructor, nursing student, nursing individual?
I run and find a new career.
Yeah. I would run and go,
scary.
yeah, I would apply at a mental hospital because I'm going to be a psych patient and I'll be nervous and scared.
Yes.
But jokes aside, honestly, when something like that does happen, what would you do if someone presented that at a hospital? What would you do?
Well, remember in nursing school, MONA. They always preach MONA. It's an acronym.
Yeah.
Morphine, oxygen,
Nitro and aspirin, right? And it's a little aspirin that you want to chew because it kicks in. How fast does it kick in? You guys know this? No? Okay, 30 minutes. You want it to kick in faster than that's why you bite on it, but that's a different story. So,
whoa, we're gonna bite on it. Come on, never bite.
Just chew on it. So that's very important that we do MONA. But
sorry.
So that's very important that you follow the MONA steps. So that's very important. So if that's
back. Research shows you want to give aspirin, okay? Commonly, doctors prescribe 162 milligrams up to 324 milligrams, okay? Right. All you're trying to do is prevent any more clots from forming. Aspirin is an antiplatelet, okay? Yes. One of the most important steps to do right away, aspirin, okay? Now, next one, oxygen.
Oxygen. And when you put oxygen on, you got to make sure you don't go over 2 to 4 liters. It's always 2 to 4. High flow oxygen won't make a huge difference. It won't. They say it won't. I don't have a rationale behind it, but I'm just saying.
And also, if the patient's already setting 95 and above on the oxygen, you might want to think about, do they really need oxygen? Okay? And the COPD, but that's a whole other story. You're talking about complicating the issue. We're just trying to give you a simple instruction so that you know what to do so you don't flip out.
A simple picture of what it is, okay, man? Okay. And then the next one you're going to do is what?
You give nitro.
Nitro. Now, here's 3 things you got to look for that you're not going to give nitro for a patient. The very first thing you're not going to do is ask them, hey, this is funny. Do you take Viagra? Yes. Even women could take it. Whoa, do you take Viagra?
Because remember, Viagra is a blood pressure medication.
Yeah.
So some women, believe it or not, do have Viagra to help control the blood pressure. You know, guys use it for a different reason. Okay.
Yeah.
Nothing wrong with it.
Yeah, there's nothing wrong with it.
And we all have our bad days.
We do, and there's and we're gonna make this video long and
whoa. You can't put Viagra long in the same sentence.
Okay. Too late. Can't do it. So we got to make sure that when you ask someone about Viagra, it's a vasodilator. It puts the blood where it needs to be for that individual. But sometimes women take it also. Why do women take it?
Blood pressure medication. Because Viagra was first built as a blood pressure medication.
There you go.
All they did was find that, hey, woohoo, holla, woohoo. You had an interesting side effect. They can make a lot more money off of them.
Yes.
Okay?
So you want to look for that, and that's the other thing you want to ask for if they're going to take nitro is what's the other one?
You have to make sure that it's not present as a right-sided MI, right-sided myocardial infarction.
Right.
Okay.
Infarction.
Just to kind of make it a little simple, so we don't bore you guys. Right-sided heart has to do with preload. Okay. When the heart on the right side is already not pumping where it should be, when you have that MI, if you were to give that nitro, you'd actually decrease that preload even further, and you would just bottom out that blood pressure.
And we don't want to bottom out that patient.
No, sir. You're going to have a whole other issue for you.
Bolus them. Yeah. You weren't going to go to shock. Ain't nobody got time for that.
No.
So the third one you want to look for. What was the third one?
What was that third one? Let me think.
What was that one?
Well, I guess if they already have low blood pressure, if they're coming in systolic and 90 to 100, you don't want to give that.
Yeah.
What you going to do?
Bottom them out.
You have a whole other issue on your hand. Okay?
Doctor's going to yell at you. You need your license. You don't want none of that.
Perfect. So that last one, the M.
Yeah. The last one is aspirin. Okay.
No, M. Or morphine.
Morphine. No,
yes.
We went MONA.
No, we talked about aspirin. The acronym is MONA. Okay. But you don't give morphine first.
MONA. Morphine.
MONA does not. So you don't give them in that order.
No.
MONA is just a simple way to remember it, okay?
Yeah.
The last one, morphine.
Morphine. Now, what does morphine do? Morphine is also a vasodilator. It expands and brings down the blood pressure. Plus, it brings down the chest pain that they're having, right arm pain, left arm pain. It decreases that. So it does 2 things. Morphine does help for 2 things. Decreasing blood pressure, vasodilating, and making the heart muscle not to work so hard sufficiently. Plus, it brings down the pain.
And think about it. Patients in huge amounts of pain, they're not going to really want to sit for that EKG. Give them that morphine, calm down that anxiety, calm down that pain. It'll be a lot more happier patient, someone you can actually work with.
Oh yeah, and they're gonna love you, bring down all that stuff. So definitely look for that. Now we know Mona. That's Mona. We all know Mona. You know what I'm saying?
Yeah.
So that's very important.
Okay, so next time you're ever in a hospital setting, patient complains of chest pain. Okay. There's no reason to freak out because you wore your right scrubs and you took a big poo-poo in the back.
Yeah,
You got
poo-poo.
scared.
Yeah,
no,
it happens.
Calm down. Sit back.
You don't
Think
want
of
that.
NurseBrothers.
That's how you
Mona.
do it. That's
Okay?
it. All right.
All you gotta remember.
That's all we gotta say.
More to
Don't
come.
forget, hit that like button. It's not over here. Yeah, it's actually over there.
It's somewhere down there. It's over here.
Hit the like button. All right.
This right here?
Hey.
Yeah, right here.
Mm-hmm.
Okay.
My fellow YouTube nurses.
Salutations.
Salutations.
Bye.